Sound speed. Action.
You were working with Governor Carcieri before Governor Chafee. What was it like working as a Republican governor as a Democrat?
Well, I'm a Democrat and haven't had a Democratic governor yet in my 2 terms. It was very different working with Governor Carcieri than it is working with Governor Chafee. Governor Carcieri and I differed ideologically, but also had a difficult time working out a collaborative relationship. Governor Chafee and I, on the other hand, when Governor Chafee came in, he really respected the work I had been doing on health care, knew it was a huge issue for the state as we're implementing the national law, and so turned to me and said, let's work together, which has been a great experience, and I think it served the state well.
Do you think that's easier to do on a state level than on a federal level, form sort of close working relationships? Or do you think that's sort of largely irrelevant?
Actually, I think both the last 2 vice presidents and presidents in this analogous relationship have had very strong, the vice presidents have had much stronger roles than we had seen for quite some time. Vice President Cheney, not someone I saw eye to eye with, but you could see his influence in the administration and his role. And Vice President Biden, I think, has a very strong role to play, particularly working across the executive legislative divide because of this long experience in the U.S. Senate.
You were talking about healthcare. Healthcare is obviously something you're very big on. The Affordable Care Act has been sort of coming into force over the past couple of years, and looking forwards, it's going to keep gathering pace. Have your constituents started to see concrete benefits to it yet, or is it still yet to come?
Well, absolutely. There are several things that have already happened, and often people don't know unless they directly benefit. So for me, I directly benefit. I have a 24-year-old daughter who is working. She is back on my health insurance because she didn't have that available to her. That's a major benefit for her and for me as her parent, as her mom. That's true. Last year was the first year in a few decades that the number of uninsured Americans declined, and that was because so many of our young adults came back on their family's coverage. Very inexpensive way to insure people, and a good way to protect them from any kind of serious catastrophic illness, and to get them, if they have any kind of chronic illness, to actually take care of it. You know, one of the tragedies in the American system is you're actually most vulnerable when you're seriously ill to healthcare costs, and most people believe their insurance protects them from that. But in many states, you could, once you had cost a certain amount, you could be terminated from your insurance coverage. Those changes, which will have a huge national impact, and already aren't as visible here because we already had state protections.
A major criticism of Obamacare is that it taxes companies developing new technologies, and it therefore cuts down on R&D budgets and could potentially reduce healthcare innovation. What would you say to that?
Well, they just voted to repeal, actually, one of the things that was most troubling to people, which was the tax on the medical device manufacturers. I think that has made it all the way through. I think there needs to be a balance. I think it is very important that this program is paid for appropriately. I think that we also need to support innovation, both in our drug industry and in our device industry, but we need to be careful that we aren't supporting that innovation at too high a cost to the people that it's ultimately there to benefit.
To what extent do you see your approval ratings as linked with Governor Chafee's approval ratings?
So I have the blessing of not running for office again, and I'm not worrying very much about my approval ratings. But I think everyone right now, certainly those of us who've been in office for a while, and Governor Chafee is new in the governor's role, but has been a public figure for quite some time. In these tough times, particularly in Rhode Island, where we still haven't got our economy going as well as it could, I think we all pay the price, and as we should. We're elected leaders, and we bear some of the responsibility for situations that our state is in. I think the governor and I and all of us at the state level have been really pushing hard to make some change. The governor's focus on education improvement, for example, and staying the course on improving our public education system, absolutely vital to our long-term health. So I think all of us suffer with that to some extent, but I think if you live and die by your poll numbers, you don't take on some of the tough issues that need to be taken on.